Question 1. A registered nurse is caring for a patient admitted under Section 2 of the Mental Health Act. The patient, who has capacity regarding their physical health, is refusing a vital blood test required for a suspected acute physical illness, stating, "You can't make me, I'm already detained." What is the nurse's most appropriate initial action? A. Inform the patient that as they are detained, all tests can be carried out without their consent. B. Respect the patient's refusal, as the Mental Health Act only covers mental health treatment. C. Explain the purpose and importance of the blood test, assess their understanding, and if they retain capacity for this decision, respect their refusal while escalating to the multidisciplinary team for a best interest meeting regarding their physical health. D. Seek a second opinion from another doctor to legally override the patient's refusal. Answer: C. Explain the purpose and importance of the blood test, assess their understanding, and if they retain capacity for this decision, respect their refusal while escalating to the multidisciplinary team for a best interest meeting regarding their physical health. This question tests the nuanced application of the Mental Health Act alongside the Mental Capacity Act. The keywords admitted under Section 2, capacity regarding their physical health, and refusing a vital blood test highlight that detention for mental health does not automatically remove capacity for physical health decisions. The nurse's role is to assess capacity for that specific decision, provide comprehensive information, and if capacity is present, respect the patient's autonomous choice, while still advocating for a best interest decision if significant harm is likely. For instance, even a detained patient can refuse a flu vaccine if they understand the implications. Always remember that capacity must be assessed for each specific decision, and it is not a blanket concept. Question 2. A nurse is conducting a medication round. A patient with a history of dysphagia, difficulty swallowing, is prescribed a new enteric-coated tablet. The patient struggles to swallow tablets whole. What is the nurse's most appropriate action? A. Crush the tablet and administer it with applesauce, as crushing helps. B. Inform the patient that they must try harder to swallow the tablet whole. C. Contact the prescriber or pharmacist to clarify if the tablet can be crushed or if an alternative formulation, e.g., liquid E, is available. D. Administer the tablet with a large glass of water, hoping it will go down. Answer: C. Contact the prescriber or pharmacist to clarify if the tablet can be crushed or if an alternative formulation, e.g., liquid E, is available. This question challenges a nurse's medication safety knowledge and problem-solving skills, particularly with patients experiencing dysphagia. The keywords dysphagia and enteric-coated tablet are critical, as crushing enteric-coated medications can destroy their special coating, making them ineffective or causing adverse effects. The most appropriate action is to avoid potentially harmful alterations and instead consult with the prescriber or pharmacist for a safe alternative or confirmed method of administration. For example, if a patient cannot swallow, a liquid alternative is often safer. Always remember to never crush or alter medications without confirming it is safe to do so. Question 3. A newly qualified nurse identifies a medication error made by a senior colleague that resulted in minor but noticeable harm to a patient. The senior colleague asks the new nurse to keep it between us to avoid professional repercussions. What is the newly qualified nurse's immediate professional responsibility according to the NMC Code and Duty of Candor? A. Agree to keep it quiet, as challenging a senior nurse can be difficult. B. Report the senior colleague immediately to the police. C. Document the incident, ensure the patient is informed, inform the prescriber, complete an incident report, and escalate the concern about the colleague's request to management. D. Advise the senior colleague to report it themselves and monitor if they do. Answer: C. Document the incident, ensure the patient is informed, inform the prescriber, complete an incident report, and escalate the concern about the colleague's request to management. This question presents a critical ethical and professional dilemma, testing accountability, the duty of candor, and the duty to raise concerns. The keywords: medication error, minor but noticeable harm, senior colleague asks to keep it between us, and newly qualified nurse highlight the pressure to conceal. The nurse's immediate professional and ethical responsibility is to protect the patient by ensuring the error is reported, the patient is informed, and to also escalate the senior colleague's attempt to cover up the incident, upholding professional standards. For instance, the new nurse must complete a full incident report, including the senior colleague's attempt to suppress reporting. Always remember that patient safety and professional integrity override loyalty to colleagues, especially when an error has occurred. Question 4. A patient with severe anxiety has developed a persistent delusion that their food is poisoned, leading to significant weight loss. All physical causes have been ruled out, and the patient refuses to engage in any psychological therapy or medication, despite having fluctuating capacity. What is the nurse's most appropriate ongoing management approach? A. Force-feed the patient to ensure nutritional intake. B. Respect the patient's refusal of food due to their autonomy, despite the weight loss. C. Implement a graded approach to reintroduce food in a safe, low-stimulus environment, while continually assessing capacity, exploring reasons for refusal, involving a dietitian, and seeking a multidisciplinary best interest decision if capacity remains absent. D. Transfer the patient to a secure psychiatric unit for mandatory feeding. Answer: C. Implement a graded approach to reintroduce food in a safe, low-stimulus environment, while continually assessing capacity, exploring reasons for refusal, involving a dietitian, and seeking a multidisciplinary best interest decision if capacity remains absent. This question explores the complex management of a patient with both physical and mental health challenges, particularly when capacity is fluctuating. The keywords: severe anxiety, persistent delusion, significant weight loss, physical causes ruled out, and fluctuating capacity indicate a serious and multifaceted problem. The most appropriate action is a patient-centered, gradual, and multidisciplinary approach that attempts to rebuild trust and facilitate nutrition in a safe manner, always reassessing capacity and involving the team for best interest decisions. For example, offering small, familiar portions with no immediate pressure, while also engaging the mental health team to manage the delusion, could be part of the plan. Always remember to balance patient autonomy with the duty to provide life-sustaining care, especially when capacity is impaired. Question 5. A nurse observes a patient who is actively receiving a blood transfusion suddenly develop shortness of breath, a rash, and a fever. What is the first immediate action the nurse should take? A. Administer an antihistamine and continue the transfusion at a slower rate. B. Document the observations in the patient's notes and monitor closely. C. Immediately stop the transfusion, maintain access with normal saline, assess the patient, notify the medical team and blood bank, and follow the transfusion reaction protocol. D. Increase the oxygen flow rate and recheck vital signs in 15 minutes. Answer: C. Immediately stop the transfusion, maintain access with normal saline, assess the patient, notify the medical team and blood bank, and follow the transfusion reaction protocol. This question tests immediate recognition and response to a life-threatening acute hemolytic transfusion reaction. The keywords: actively receiving a blood transfusion, suddenly develop shortness of breath, a rash, and a fever are classic signs of a severe reaction. The first and most critical action is to immediately stop the transfusion to prevent further harm, then follow the established transfusion reaction protocol, which includes maintaining access, assessing the patient, and notifying relevant medical and blood bank teams. For example, stopping the blood, flushing the line with normal saline, and taking a set of observations are immediate actions. Always remember that any signs of a transfusion reaction require immediate cessation of the blood product and urgent investigation. Question 6. A nurse is preparing a discharge summary for an elderly patient with complex health needs, including polypharmacy, taking multiple medications, and a recent history of medication non-adherence. The patient lives alone. What is the most critical element to ensure continuity of care and prevent readmission? A. A simple list of their discharge medications. B. A comprehensive, clearly explained medication reconciliation plan, including a simplified regimen where possible, and a referral to community pharmacy or home care for medication support. C. A strong recommendation for the patient to ask a neighbor for help with medications. D. Documenting that the patient was verbally reminded about their medications. Answer: B. A comprehensive, clearly explained medication reconciliation plan, including a simplified regimen where possible, and a referral to community pharmacy or home care for medication support. This question challenges nurses to consider the broader social and functional determinants of health in discharge planning. The keywords elderly patient, complex health needs, polypharmacy, recent history of medication non-adherence, and lives alone indicate a high risk of post-discharge complications. The most critical element is a meticulously planned and supported medication strategy that addresses these risks, ensuring the patient understands their regimen and has practical support to adhere to it. For example, coordinating a blister pack from the pharmacy or arranging for a community nurse to set up a pill organizer would be practical steps. Always remember that effective discharge planning for complex patients requires tailored, practical support beyond just providing information. Question 7. A nurse is supervising a student nurse who is about to perform a sterile procedure. The student has verbalized all steps correctly but breaks sterile technique just before touching the patient. What is the nurse's most appropriate action? A. Allow the student to continue, but ensure they learn from this mistake later. B. Quietly correct the student after the procedure to avoid embarrassing them. C. Immediately and gently intervene, stop the procedure, and guide the student to re-establish a new sterile field and technique. D. Report the student to their university for incompetence. Answer: C. Immediately and gently intervene, stop the procedure, and guide the student to re-establish a new sterile field and technique. This question tests a supervising nurse's responsibility for patient safety and effective clinical teaching. The keywords break sterile technique and just before touching the patient highlight an immediate risk of infection. The most appropriate action is to promptly and constructively intervene to prevent patient harm by stopping the procedure and ensuring the student understands how to correctly re-establish sterility. For example, the nurse would step in and calmly say, "Okay, let's pause here. We need to make sure everything is sterile to prevent infection, so let's get a new field ready." Always remember that patient safety is paramount, and direct, immediate correction is essential when sterile technique is compromised. Question 8. A patient is observed to have a very low respiratory rate, 6 breaths/minute, and pinpoint pupils after receiving a prescribed opioid analgesic. The patient is difficult to rouse. What is the nurse's immediate priority? A. Administer a second dose of the opioid to see if the patient wakes up. B. Elevate the head of the bed to improve breathing. C. Administer prescribed naloxone, opioid antagonist, if available, ensure airway patency, provide ventilatory support if needed, and call for urgent medical review. D. Document the findings and wait for the doctor's next round. Answer C. Administer prescribed naloxone, opioid antagonist, if available, ensure airway patency, provide ventilatory support if needed, and call for urgent medical review. This question tests immediate recognition and response to opioid overdose, a life-threatening emergency. The keywords very low respiratory rate, 6 breaths/minute, pinpoint pupils, opioid analgesic, and difficult to rouse are classic signs of opioid-induced respiratory depression. The immediate priority is to reverse the opioid effect with naloxone, if prescribed and available, ensure a patent airway, support breathing, and rapidly escalate to the medical team for urgent review. For instance, after giving naloxone, the nurse would monitor the patient's breathing and level of consciousness every few minutes. Always remember that severe respiratory depression following opioid administration is a medical emergency requiring immediate reversal. Question 9. A patient with known suicidal ideation expresses feelings of hopelessness to the night nurse, stating, "I just want it all to end, but I don't want to bother anyone." The patient then requests to be left alone to sleep. What is the nurse's most appropriate immediate action? A. Respect the patient's request for sleep, as they don't want to bother anyone. B. Document the statement and check on the patient every 30 minutes. C. Conduct an immediate in-depth suicide risk assessment, implement continuous observation, e.g., 1 supervision, ensure a safe environment, and escalate to the on-call mental health team. D. Reassure the patient that things will get better and offer a warm drink. Answer C. Conduct an immediate in-depth suicide risk assessment, implement continuous observation, e.g., 1 supervision, ensure a safe environment, and escalate to the on-call mental health team. This question presents a critical mental health emergency, testing the immediate response to suicidal ideation. The keywords known suicidal ideation, feelings of hopelessness, I just want it all to end, and requests to be left alone indicate a high-risk situation despite the patient's attempt to minimize their distress. The nurse's immediate and paramount responsibility is to conduct a thorough risk assessment, implement full safety measures, such as constant observation and removing any potential means of harm, and urgently escalate to the mental health team. For example, explaining that their safety is the priority and they cannot be left alone, then actively engaging them in conversation while waiting for the mental health team. Always remember that any expression of suicidal thoughts must be taken seriously and acted upon immediately to ensure patient safety. Question 10. A patient has been prescribed a new medication that is known to interact adversely with one of their existing, long-term medications. This interaction was missed during the doctor's prescription process. What is the nurse's primary professional responsibility before administration? A. Administer the new medication as prescribed, assuming the doctor has considered all interactions. B. Administer the new medication, but closely monitor the patient for adverse effects. C. Withhold the new medication and immediately clarify the potential interaction with the prescriber or pharmacist. D. Ask the patient if they have experienced any issues with interactions before. Answer C. Withhold the new medication and immediately clarify the potential interaction with the prescriber or pharmacist. This question tests critical thinking and medication safety, specifically identifying and managing drug interactions. The keywords new medication, known to interact adversely with one of their existing, long-term medications, and interaction was missed highlight a serious potential for patient harm. The nurse's primary responsibility is to act as a safety barrier by withholding the medication and immediately clarifying the potential interaction with the prescriber or pharmacist before administration. For example, using a drug reference guide to confirm the interaction before contacting the doctor is good practice. Always remember to question and clarify any medication order that you suspect may be unsafe or incorrect. Question 11. A nurse discovers a patient's advanced care plan and do not attempt cardiopulmonary resuscitation, DNACPR, order are inconsistently documented across different sections of their medical notes, and some sections appear unsigned. The patient has fluctuating capacity. What is the nurse's immediate priority? A. Follow the most recent entry, assuming it is correct. B. Disregard the DNACPR order due to inconsistencies and plan for full resuscitation if needed. C. Immediately seek clarification and resolution of the inconsistencies from the multidisciplinary team and ensure accurate, consistent, and legally valid documentation. D. Inform the family that the DNACPR is not valid due to documentation issues. Answer: C. Immediately seek clarification and resolution of the inconsistencies from the multidisciplinary team and ensure accurate, consistent, and legally valid documentation. This question tests the critical importance of clear and legally sound advanced care planning, particularly with DNACPR orders. The keywords inconsistently documented, unsigned, and fluctuating capacity indicate a serious risk of misinterpreting the patient's end-of-life wishes. The immediate priority is to resolve these discrepancies with the multidisciplinary team to ensure the patient's wishes are correctly identified, legally valid, and consistently documented across all records, thereby upholding their autonomy and avoiding inappropriate care. For instance, holding an urgent meeting with the doctor, senior nurse, and potentially family to review and correctly document the patient's wishes. Always remember that inconsistent or unsigned DNACPR orders are invalid and must be clarified immediately. Question 12. A patient, previously oriented, is now acutely confused, disorientated, and pulling at their intravenous 4-line, despite stable vital signs. Their blood tests, however, show a slightly elevated white blood cell count, WBC, and C-reactive protein, CRP. What is the nurse's most appropriate initial action? A. Assume the patient is agitated due to the 4-line and apply soft restraints. B. Administer a sedative to calm the patient, as vital signs are stable. C. Conduct a comprehensive assessment for delirium, including a head-to-toe examination, reviewing medications, and escalating concerns to the medical team for investigation of a possible underlying infection. D. Document the confusion and continue to monitor for significant changes in vital signs. Answer: C. Conduct a comprehensive assessment for delirium, including a head-to-toe examination, reviewing medications, and escalating concerns to the medical team for investigation of a possible underlying infection. This question challenges nurses to recognize subtle signs of deterioration, specifically delirium, even when vital signs are initially stable. The keywords previously oriented, acutely confused, disorientated, pulling at their 4-line, and slightly elevated WBC and CRP strongly suggest a new, treatable medical cause like infection, even without a fever. The most appropriate initial action is a thorough assessment for delirium and potential underlying causes, followed by urgent escalation to the medical team for investigation and intervention. For example, checking for a new cough, urinary changes, or examining the foresight for signs of phlebitis would be part of the assessment. Always remember that acute confusion is a medical emergency requiring prompt investigation for an underlying cause. Question 13. A nurse receives a verbal order for a high-risk medication from a doctor during a chaotic ward emergency. The nurse believes they heard the dose correctly but is not entirely certain. What is the nurse's immediate professional responsibility? A. Administer the medication immediately, as it's an emergency and the doctor is busy. B. Write down the order and administer it, assuming the doctor would not make a mistake in an emergency. C. Use the read-back technique to clarify the order with the prescriber, then verify the written order as soon as possible, and if still uncertain, refuse to administer. D. Ask another nurse to administer the medication. Answer C. Use the read-back technique to clarify the order with the prescriber, then verify the written order as soon as possible, and if still uncertain, refuse to administer. This question tests critical communication and medication safety protocols, particularly in high-stress, emergency situations. The keywords verbal order, high-risk medication, chaotic ward emergency, and not entirely certain highlight a significant potential for error. The immediate and most appropriate action is to employ the read-back technique to clarify the order, ensuring accuracy, and only administer if absolutely certain. If any doubt remains, the nurse must refuse to administer until complete clarity and a written order are obtained, prioritizing patient safety above all else. For example, saying, "Doctor, just to confirm, you said, medication name, dose, route, time, is essential?" Always remember that in an emergency, safety takes precedence, and you must be 100% certain of a verbal order before administering medication. Question 14. A patient's family, who speak limited English, expresses significant distress after a doctor delivers bad news without a translator present. The family is now asking the nurse for clarification. What is the nurse's most appropriate action? A. Attempt to explain the bad news in simple English themselves. B. Document that a translator was not present and that the family is distressed. C. Arrange for an official medical interpreter to be present for a follow-up conversation with the doctor, and provide immediate emotional support to the family. D. Advise the family to use a translation app on their phone. Answer C. Arrange for an official medical interpreter to be present for a follow-up conversation with the doctor, and provide immediate emotional support to the family. This question addresses crucial communication standards, cultural sensitivity, and advocacy for vulnerable patients/families. The keywords speak limited English, doctor delivers bad news without a translator, and family is now asking the nurse for clarification highlight a breakdown in communication and a lack of informed understanding. The most appropriate action is to rectify this by arranging for a qualified medical interpreter to facilitate a proper, comprehensive discussion with the doctor, while offering immediate empathetic support to the distressed family. For example, finding a quiet space for the family and offering them tissues while explaining that a translator will be arranged. Always remember that official interpreters are essential for complex medical conversations with non-English speaking patients and families to ensure accurate understanding and consent. Question 15. A nurse identifies that a patient's prescribed intravenous fluid, IVF, bag is critically low, and there is no replacement IVF available on the ward. The patient requires continuous hydration due to a specific medical condition. What is the nurse's immediate priority? A. Slow down the infusion rate to make the remaining fluid last longer. B. Document the lack of IVF and notify the doctor on the next ward round. C. Immediately contact pharmacy or the hospital's central stores to obtain a replacement, and if unavailable, alert the medical team for an alternative plan. D. Ask a colleague to check their ward for a spare bag. Answer C. Immediately contact pharmacy or the hospital's central stores to obtain a replacement, and if unavailable, alert the medical team for an alternative plan. This question tests a nurse's proactive problem-solving and resource management in a critical care situation. The keywords critically low, no replacement IVF available, and patient requires continuous hydration due to a specific medical condition highlight an urgent need to prevent disruption of essential treatment. The immediate priority is to actively source the necessary supplies through appropriate channels, escalating to the medical team for an alternative solution if stock cannot be obtained quickly. For example, calling the pharmacy or requesting an urgent delivery from central stores. Always remember that ensuring continuous, essential patient treatment requires proactive management of supplies and timely escalation of resource shortages. Question 16. A patient is due for discharge but expresses extreme fear of leaving the hospital due to an irrational fear that their home is infested with insects, despite environmental health checks confirming otherwise. The patient has capacity to make discharge decisions, but this fear is causing significant distress. What is the nurse's most appropriate discharge planning strategy? A. Discharge the patient with reassurance that their home is safe. B. Delay discharge indefinitely until the patient overcomes their fear. C. Collaborate with the patient, family, mental health team, and social services to address the underlying phobia and arrange a supported, gradual transition home with community mental health support. D. Inform the patient that their bed is needed and they must leave. Answer: C. Collaborate with the patient, family, mental health team, and social services to address the underlying phobia and arrange a supported, gradual transition home with community mental health support. This question tests complex discharge planning for a patient whose mental health significantly impacts their ability to transition home, despite physical readiness. The keywords extreme fear, irrational fear, causing significant distress, and capacity to make discharge decisions indicate a need for a person-centered approach that supports the patient's autonomy while addressing their mental health needs. The most appropriate strategy is a multidisciplinary approach focused on managing the phobia and ensuring a psychologically safe transition home, rather than just dismissing their fears or forcing discharge. For example, arranging for a mental health nurse to visit the patient at home might reduce anxiety. Always remember that discharge planning must address all aspects of a patient's well-being, including their mental health, to ensure a safe and successful transition. Question 17. A nurse is documenting care for a patient who sustained a fall on the ward. Which documentation entry would be considered most comprehensive and professionally appropriate? A. Patient fell out of bed. No obvious injury. Checked on patient. Looks fine. B. Patient found on floor at 08:30 near bed. Alert and oriented X3. Denies pain. Full head-to-toe assessment performed, no visible injury. Vitals stable. Doctor informed. Incident report completed. Safety measures, bed alarm, reinforced. Patient repositioned to bed safely. C. Patient had a fall. Family notified. D. Patient was clumsy and fell. Discussed with oncoming shift. Answer: B. Patient found on floor at 08:30 near bed. Alert and oriented X3. Denies pain. Full head-to-toe assessment performed, no visible injury. Vitals stable. Doctor informed. Incident report completed. Safety measures, bed alarm, reinforced. Patient repositioned to bed safely. This question tests the essential components of professional and comprehensive documentation, particularly following an adverse event. The phrase, most comprehensive and professionally appropriate, highlights the need for factual, objective, and action-oriented recording. A complete entry includes the objective observation of the event, immediate assessment findings, including neurological and physical, actions taken, doctor notified, safety measures, and relevant follow-up, incident report. For instance, documenting the time, exact location, and the patient's status post-fall is crucial for legal and clinical review. Always remember that good documentation is factual, thorough, and reflects the entire nursing process following an incident. Question 18. A patient on a long-term ventilation unit has an advanced care plan stating they wish for no further invasive interventions. The patient then develops a severe respiratory infection. The medical team proposes a new, non-invasive antibiotic treatment. The patient, with capacity, initially agrees but later expresses doubt and confusion to the nurse, stating, "I just want to be left alone." What is the nurse's immediate priority? A. Reassure the patient that the antibiotic is not invasive and proceed with treatment. B. Refer to the advanced care plan and withhold all treatment, including antibiotics. C. Reassess the patient's understanding and capacity for this specific decision, antibiotic treatment, provide clear information, and involve the MDT if doubts persist to ensure consent or a best interest decision is made. D. Document the patient's doubt and assume they are now refusing the antibiotics. Answer: C. Reassess the patient's understanding and capacity for this specific decision, antibiotic treatment, provide clear information, and involve the MDT if doubts persist to ensure consent or a best interest decision is made. This question tests the complex interplay of advanced care planning, ongoing capacity assessment, and consent for new treatments. The keywords advanced care plan stating no further invasive interventions, develops severe respiratory infection, non-invasive antibiotic treatment, and expresses doubt and confusion highlight a nuanced situation. The immediate priority is to reassess the patient's capacity and understanding of this new, non-invasive treatment, clarifying information and involving the multidisciplinary team if the patient's capacity or wishes are unclear. For example, clarifying that antibiotics are not a futile invasive intervention, but are to treat the current infection. Always remember that advanced care plans apply to specific interventions, and a patient with capacity can always consent to or refuse new treatments, requiring ongoing assessment. Question 19. A newly admitted patient, who is a trans man, requests to be referred to by his chosen name and pronouns, he/him. However, some staff members are consistently using his birth name and referring to him as she or her, causing him distress. What is the nurse's most appropriate action to address this? A. Inform the patient that staff are busy and may struggle to remember new names/pronouns. B. Document the patient's request but take no further action as it's a personal preference. C. Immediately educate and remind staff members of the patient's chosen name and pronouns, highlight the importance of respectful communication, and ensure the care plan is clearly updated. D. Advise the patient to try to be more understanding of staff. Answer: C. Immediately educate and remind staff members of the patient's chosen name and pronouns, highlight the importance of respectful communication, and ensure the care plan is clearly updated. This question tests cultural competence, respectful communication, and advocacy for LGBTQ+ patients, aligning with the NMC Code's principles of treating people as individuals and respecting dignity. The keywords trans man, chosen name and pronouns, staff consistently using birth name and wrong pronouns, and causing him distress highlight a clear breach of respectful and person-centered care. The most appropriate action is to immediately intervene by educating and reminding staff, reinforcing the importance of using correct names and pronouns, and updating the care plan to reflect this clearly. For example, ensuring that the patient's chosen name is highlighted on their chart and during handover. Always remember that using a patient's chosen name and pronouns is fundamental to respectful, dignified, and inclusive care. Question 20. A nurse is performing a complex wound dressing change on a patient with a compromised immune system. During the procedure, the nurse accidentally touches the sterile field with their bare hand. What is the nurse's immediate professional responsibility? A. Complete the dressing change quickly, as the patient needs it. B. Continue with the procedure, assuming a brief touch won't cause harm. C. Immediately stop the procedure, remove all contaminated items, wash hands thoroughly, and re-establish a completely new sterile field and apply new sterile gloves. D. Apply a fresh pair of sterile gloves over the contaminated ones and continue. Answer C. Immediately stop the procedure, remove all contaminated items, wash hands thoroughly, and re-establish a completely new sterile field and apply new sterile gloves. This question tests critical adherence to aseptic technique and patient safety, especially for vulnerable patients. The keywords complex wound dressing change, compromised immune system, and accidentally touches the sterile field with their bare hand indicate a high risk of introducing infection. The immediate and paramount responsibility is to recognize the breach, stop the procedure, and completely re-establish sterility from scratch to prevent potentially life-threatening infection for a vulnerable patient. For example, if you touch the sterile field, you must immediately remove the contaminated gloves and dressings, re-wash your hands, and set up new sterile equipment. Always remember that any breach of sterility, especially for immune-compromised patients, requires a complete re-establishment of the sterile field to ensure safety. Question 21. A patient on a medical ward reports feeling extremely anxious and restless, stating, "I feel like something bad is going to happen." Their vital signs are within normal limits, but their family reports this is a sudden change from their usual calm demeanor. What is the nurse's most appropriate initial action? A. Administer a prescribed as needed sedative to alleviate their anxiety. B. Reassure the patient and family that their vital signs are normal, so there is nothing to worry about. C. Conduct a comprehensive assessment for an underlying physical cause of the anxiety/restlessness, e.g., pain, hypoxia, infection, medication side effect, while providing psychological reassurance. D. Document the anxiety and inform the mental health liaison team. Answer C. Conduct a comprehensive assessment for an underlying physical cause of the anxiety/restlessness, e.g., pain, hypoxia, infection, medication side effect, while providing psychological reassurance. This question challenges nurses to look beyond the obvious psychological presentation and investigate potential physical causes for acute changes in mental state. The keywords extremely anxious and restless, something bad is going to happen, vital signs are within normal limits, and sudden change from their usual calm demeanor are classic, but subtle, signs of acute physical deterioration or delirium that can manifest as anxiety. The most appropriate initial action is a thorough physical assessment to rule out reversible organic causes before assuming a purely psychological issue, while also offering reassurance. For example, checking their oxygen saturation, assessing for pain, or reviewing recent medications for side effects would be essential. Always remember that a sudden change in a patient's mental state, even with normal vitals, warrants a comprehensive physical assessment for an underlying cause. Question 22. A nurse is asked by a patient's next of kin to view the patient's medical records because they hold a lasting power of attorney, LPA, for health and welfare. The patient, though currently lacking capacity, explicitly stated before losing capacity that they did not want this next of kin to have access to their medical records. What is the nurse's professional responsibility? A. Allow the next of kin to view the records, as they have an LPA. B. Decline the request, as the patient's previously expressed wishes take precedence over the LPA in this specific matter. C. Provide a verbal summary of the patient's condition but not the full records. D. Ask the patient's doctor to make the decision. Answer B. Decline the request, as the patient's previously expressed wishes take precedence over the LPA in this specific matter. This is a complex legal and ethical question about the limits of a lasting power of attorney, LPA, for health and welfare. The The keywords LPA for health and welfare and patient, though currently lacking capacity, explicitly stated before losing capacity that they did not want this next of kin to have access to their medical records, are crucial. While an LPA grants decision-making power, the Mental Capacity Act 2005, MCA, stipulates that a person's valid and applicable past wishes and feelings must be considered and can, in certain circumstances, limit the scope of the LPA. The nurse must respect the patient's clear prior wishes regarding information sharing. For example, the nurse would explain to the LPA holder that while they have authority for health and welfare decisions, the patient had expressed a specific wish not to share their records with them, and this wish must be upheld. Always remember that an LPA does not automatically override a patient's clear, previously expressed wishes regarding confidentiality, even if they now lack capacity. Question 23. A senior nurse consistently uses derogatory language towards junior staff and makes inappropriate jokes, creating a hostile work environment. When challenged informally, the senior nurse dismisses the feedback as oversensitivity. What is the immediate professional responsibility of other registered nurses on the ward? A. Avoid further confrontation and tolerate the behavior to maintain peace on the ward. B. Document specific instances of the behavior and escalate formal concerns through the organizational hierarchy, e.g., to human resources or senior management, citing the NMC code. C. Organize a collective staff meeting to confront the senior nurse. D. Report the senior nurse to the NMC directly, bypassing internal channels. Answer: B. Document specific instances of the behavior and escalate formal concerns through the organizational hierarchy, e.g., to human resources or senior management, citing the NMC code. This question tests a nurse's responsibility to challenge inappropriate professional conduct and maintain a safe working environment, aligning with the NMC code. The keywords derogatory language, inappropriate jokes, hostile work environment, and dismisses the feedback highlight a persistent problem affecting staff well-being and potentially patient care. The most appropriate immediate action is to document specific examples of the behavior and formally escalate these concerns through the organization's established channels, citing breaches of the NMC code standards for professional behavior and respect. For instance, creating a factual log of dates, times, and specific comments before reporting to a line manager or HR ensures the concerns are taken seriously. Always remember that creating a positive and respectful work environment is a professional duty, and persistent inappropriate behavior must be formally addressed. Question 24. A patient, newly diagnosed with a life-limiting illness, asks the nurse for information about specific alternative therapies they saw advertised online, which contradict established medical advice. The patient is very hopeful about these therapies. What is the nurse's most appropriate response? A. Dismiss the alternative therapies as unproven and focus only on medical treatments. B. Encourage the patient to try the alternative therapies if they wish, as long as they feel it helps. C. Acknowledge the patient's hope, listen to their understanding of the therapies, gently discuss the lack of scientific evidence, and explore how these might interact with conventional treatments, while promoting open communication with the medical team. D. Immediately contact the doctor to inform them of the patient's unrealistic expectations. Answer: C. Acknowledge the patient's hope, listen to their understanding of the therapies, gently discuss the lack of scientific evidence, and explore how these might interact with conventional treatments, while promoting open communication with the medical team. This question challenges a nurse to navigate sensitive conversations about alternative therapies, balancing patient hope with evidence-based practice and autonomy. The keywords newly diagnosed with a life-limiting illness, alternative therapies they saw advertised online, contradict established medical advice, and very hopeful highlight a delicate situation. The most appropriate response is empathetic, acknowledging their hope, then providing balanced information about evidence and potential interactions, while empowering them to discuss this openly with their medical team. For example, a nurse might say, "It's understandable to look into every option. Let's talk about what you found and how it might fit with your current treatment plan." Always remember to engage patients respectfully about alternative therapies, providing factual information and encouraging open dialogue with the whole healthcare team. Question 25. A registered nurse is managing a ward when a serious incident occurs involving a patient and a visitor, requiring immediate emergency response. Simultaneously, the hospital's electronic record system crashes, preventing access to patient notes, and the ward's only phone line goes down. What is the nurse's immediate priority in managing the overall situation? A. Attempt to fix the electronic record system and the phone line first. B. Delegate a colleague to deal with the patient-visitor incident, while the nurse focuses on documenting everything manually. C. Prioritize the immediate safety of the patient and visitor involved in the incident, initiating physical response measures, and then adapting communication and documentation using alternative, paper-based methods. D. Wait for clear instructions from senior management on how to proceed with multiple simultaneous crises. Answer: C. Prioritize the immediate safety of the patient and visitor involved in the incident, initiating physical response measures, and then adapting communication and documentation using alternative, paper-based methods. This question presents a complex, multifaceted crisis, testing a nurse's ability to prioritize, adapt, and maintain safety under extreme pressure. The keywords serious incident, requiring immediate emergency response, electronic record system crashes, and phone line goes down signify a breakdown of normal operations during an urgent event. The immediate priority is always the physical safety and well-being of those directly involved in the emergency incident, adapting all other processes, communication, documentation, to ensure this, using available alternative methods. For instance, using runners to deliver messages if phones are down, and starting paper charts for critical information. Always remember that immediate patient and staff safety takes precedence, and you must be adaptable in managing resources during unforeseen crises.